The pandemic itself is obviously a scary time, and there are a lot of challenges associated with it, but I think it's also brought a lot of positivity in terms of the way we teach. We've learned a lot of things on the way we deliver our assessments, the way we teach our students, the way we connect with our students. One of the assessments that we normally do on campus is a OSCE, which stands for Objective Structured Clinical Examination, and it's an assessment of skills. So with the role play assessment, the student simulates a pharmacist in training or as a pharmacist, and they're communicating with another patient or a carer. It's one of the core assessments that we do within the faculty, but they have to be done face-to-face, or so we thought. So we converted our OSCEs to online OSCEs in a few different sort of ways. Firstly, we did a video recording assessment, which helps with students who are living overseas, who have internet issues, so they can do this asynchronously. The second one, we do our OSCEs live over Zoom. So they will have a simulated patient over Zoom and they will communicate with them live, and this is done synchronously. The third one is we often have our students demonstrating and educating a patient how to use things like an inhaler or devices, but we had to change the learning outcome slightly because students won't have the devices at home and they're living on their own. So we've had to convert it whereby the patients are the ones that will be holding the device, and it's a different skill the students will be learning, which is observing how the patient uses it and counseling them on the best way to use a particular device. But the fact that they're doing video recording assessments also means that they can submit what they deem a perfect video. This also means that they're practicing multiple times, achieving the learning outcome, because a lot of the skills they develop is through practice. So if they're going to practice 10 times to get the perfect video to submit, I think we've met the learning outcomes or even more than what we wanted to achieve. With the profession changing rapidly, moving assessments online, the students are learning a different set of skill, which is around communicating with people over the internet. That will prepare them for telehealth and things that are emerging. If you're nervous about your exams, we're here to support you and we're here to help you. We'll provide as much practice as you will require before an assessment. If you have an online assessment doing role plays over Zoom, you will get practice prior to that. You're not going to be thrown straight into an assessment, and we will listen to you if you have any concerns.